Hey guys, welcome back to our channel Rick Megha. Myself Upasona Panday. I'm a second professional MBBS student from NILRATAN SIRCAR Medical College and Hospital. So in this video, we will be talking about one of the most important topic of the lower limb, that is the venous drainage of the lower limb. This is one of the favorite question of the examiner. In fact, we got this question this time in our paper. So let us begin with our discussion. So what do we need to study? First thing, what are the veins? Then there should be some valves because these are the veins of the lower limb, and in order to prevent the backflow, there should be the presence of the valve. And if there are any special notes regarding any of the veins and some clinical correlation. So what are the veins? The veins are the superficial veins, deep veins and perforators. When we talk about the superficial veins, what are these? The superficial veins are the veins that lie in the superficial fascia. So the veins which lie in the superficial fascia are the superficial veins. What are the superficial veins? The great saphenous vein. You see this diagram? This is the great saphenous vein and the small saphenous vein. These are the two important superficial veins of our lower limb. Now let us look into the deep veins. What are the deep veins? Deep veins are the veins that lies deep within the deep fascia and surrounded by bulky muscles. Those are the deep veins. What are those? The femoral vein, the popliteal vein, the anterior tibial vein, the posterior tibial vein and the peroneal vein. Let us find out the veins. This is our femoral vein that continues as the popliteal vein. Then this is our anterior tibial vein, this is our posterior tibial vein and this is our peroneal vein, which is a tributary of this posterior tibial vein. Okay. Oh, I made a mistake. The popliteal vein does not continue as the anterior and the posterior tibial veins, but posterior and the anterior tibial veins join to form the popliteal vein. So these are our deep veins. Okay. Now let us look into these perforators. What are these? These are the connectors. These are the connectors between the superficial and the deep veins of the lower limb. Those communicate and there is the flow of blood from this tube via these perforators. So let us look into this purple colored, these are the perforators. These are the perforators of our lower limb. Okay. Now let us look into the veins one by one. So let us start with the superficial veins. This is our great saphenous vein. So when we talk about the great saphenous vein, this starts as the continuation of this dorsal venous arch. Okay, the dorsal venous arch continues as the great saphenous vein, and this is our medial marginal vein of the foot, which joins and accompanies the dorsal venous arch in forming the great saphenous vein. And after formation, you see, this is our medial malleolus. So this great saphenous vein after formation passes in front of the medial malleolus and goes all along the medial side of the leg. And when it reaches our knee, the popliteal fossa, then it goes thoda posterior-medially like this, and this is a side view, so this is not clear. If we draw the posterior view, then we will find that this goes posterior, this goes to the posterior aspect of our leg, okay, of our lower limb. Okay, this goes like this. If this is considered the medial and this is the lateral side, so and this is our posterior side, then the vein just goes like this in the region of the popliteal fossa. Okay. Now what we will see, then this popliteal, in the popliteal fossa, it goes in the posterior medial aspect, and then it again come to the medial aspect of the thigh. Then it ascends up, then it pierces the cibriform fossa, which covers the saphenous opening, and then it goes deep and then pierces the femoral sheath. This is our femoral vein. So this is covered, this lies within the femoral sheath, within the intermediate compartment of the femoral sheath. So this pierces the femoral sheath and ultimately drains into this femoral vein. Are we clear with this? So let us again look at the course. This is our dorsal venous arch, and this is our medial marginal vein of the foot. These two joins to form the great saphenous vein, which goes in front of the medial malleolus and then ascends all along the medial side of the leg, and then in the popliteal region it goes thoracoposteromedially and then again come in the medial aspect and ascends up in the medial side of the thigh, then pierces the cibriform fossa, then goes deep, then pierces the femoral sheath within which our femoral vein lies, and then ultimately drains into our femoral vein. That is the whole course of this great saphenous vein. Okay. Now what are the tributaries of the great saphenous vein? We have seen these are the forming tributaries, this dorsal venous arch and the medial marginal vein of the foot, and then it gives two tributaries below our knee. One is the posterior arch vein. You see, this is our posterior arch vein that drains into the great saphenous vein, and this is the anterior leg vein. These two are just below knee. Okay. And in the thigh, what are the veins? One is the anterolateral vein and another is the posteromedial vein, which two drains into our great saphenous vein. Okay. And in this region where it pierces the cibriform fossa, three tributaries joins the our great saphenous vein, which accompanies the superficial branches of the femoral artery. What are those? This superficial circumflex iliac vein, superficial epigastric vein and superficial external pudental vein. These three tributaries accompany the three superficial branches of our femoral artery. Those are the superficial circumflex iliac artery, superficial epigastric artery and superficial external pudental artery. So this pudental, this drains from our genital areas. Okay. This epigastric vein, this drains superficially epigastric, this drains from cutaneous regions of our lower abdomen, and this superficial circumflex iliac, this drains our upper part of the thigh, and like that. Okay. So we are clear with this great saphenous vein. Now let us go back to our slide, and this is then we will discuss about the small saphenous vein. This small saphenous vein, this is a tributary of our popliteal vein. A short saphenous vein drains the posterior aspect of our leg, the cutaneous part of the posterior aspect of our leg, and on its laterally it is accompanied by the sural nerve, which is again a cutaneous nerve of our leg. Now let us see this short saphenous vein starts as the lateral continuation of our dorsal venous arch. Okay. So this was our dorsal venous arch, this is our great saphenous, and on the lateral side our short saphenous vein begins, and this is also accompanied by the lateral marginal vein of our foot. So the lateral marginal vein of the foot along with the dorsal venous arch joins to form our short saphenous or small saphenous vein. This goes along the posterior aspect. So this should ascend behind the lateral malleolus. This will ascend behind the lateral malleolus and then goes up and ultimately drains into the popliteal vein after piercing the deep fossa, and then goes along the two heads of the gastrocnemius and then finally drains into our popliteal vein. And then what I said you, that this great saphenous vein you see in the popliteal region, it ascends the posteromedial course. So we are done with this discussion of the small saphenous vein. Along with this, we are done with our discussion of the superficial veins of the leg. One more thing which I should tell you, that this termination of this small saphenous vein is not constant. It ends mostly in the popliteal vein, but there are some other terminations. What are those? Now it joins with the great saphenous vein. It can join with the great saphenous vein. In that case, it is called the accessory saphenous vein, which drains into the great saphenous vein. Or it can bifurcate. One will join with the great saphenous vein and the other will end in the popliteal vein. And it sometimes fails to reach the knee and ends in the great saphenous vein below the knee. If you can remember this, okay, otherwise just remember that it drains in the popliteal vein. Okay, so we are done with the discussion of the superficial veins. So we are ending our lecture along with this discussion of the superficial veins, and we will continue from the deep veins in the next lesson, in the next video. Okay, till then, take care, tata, bye bye. For the full handwritten notes on this venous drainage of the lower limb, join our Telegram channel. There I will post the handwritten notes on this venous drainage of the lower limb with handwritten diagrams. So quickly join our Telegram. Okay, take care, tata, bye bye.